Hello, everyone. My name is Mary Muko. I'm a specialist on the Provider Outreach and Education team at WPS Government Health Administrators. I will be your host for this webinar today. Assisting me is my friend and colleague, Bailey Lawson, and other members of the PO team who may help during the question and answer portion of this call. So as you can see, this is the title of our program today. It is Part B, Mental Health Bundling. This is a disclaimer that we include in all of our education, and we do so to remind our providers and learners that Medicare rules do often change. They are in the relevant laws, regulations, and rulings located on the Centers for Medicare and Medicaid Services, or CMS, website. We will provide responses to questions based on the facts given, but these Medicare rules, regulations, and laws will determine final coverage. As a final reminder here in this disclaimer, we've included that CMS prohibits recording of this presentation for profit-making purposes. Now, today's webinar is the fourth in a series of 6 Part B mental health webinars. And these are really designed as an entry-level introduction to coverage and payment for Part B mental health services. There is on this particular slide a link to a CMS publication, and this publication has a lot of great material in it. I am referring to this publication often during this webinar series. Now, one thing, or a couple of things, 3 to be exact, that are not included in this webinar series are those things that are listed here at the bottom of the slide. This Part B mental health series does not include VIII, psychological and neuropsychological testing, or opioid treatments. The VIII, of course, stands for Behavioral Health Integration Services. CMS does provide education on all of those on their website. Here's the agenda for today's webinar. We're going to talk about same-day billing guidelines, and CMS addresses this in that book that I mentioned earlier. I'm going to share some details with you about the National Correct Coding Initiative, NCCI, procedure to procedure, PTP edits, and finally, I'm going to demonstrate how to use those NCCI procedure to procedure edits. Now, even though we are talking today about bundling of services that are rendered on the same day, it's really important to note that medical necessity is the overarching criteria for Medicare payment. And this, of course, is based on language in the Social Security Act. I've included a link to that section of the Social Security Act, should you want to take a look at it later. Today, though, I'm going to talk about what Medicare can consider for payment when more than one service is rendered on the same day for the same patient. But remember that in order for the service to be covered, it also needs to be properly documented as being medically necessary. It would also need to be otherwise covered by Medicare. You might hear one of us at Medicare say, well, the service needs to be medically necessary, but it also needs to be otherwise covered. And what we're talking about here are some things such as the service can't be a duplicate. Of course, it would need to be submitted correctly by an eligible provider for an eligible beneficiary. And of course, it would need to be correctly coded. I've inserted this slide just to kind of show the MLN booklet that I'm referring to throughout this webinar series. The last update for this booklet was May of 2023. You can see I've got a shot there of the cover of the MLN booklet, Medicare and mental health coverage, as well as the first page of the table of contents. And it is on page 28, where CMS includes some same-day billing guidelines. It says there that CMS pays for reasonable and necessary integrated healthcare services provided on the same day to the same patient by the same or different professionals in the same or different locations. Here then is that information on same-day billing guidelines. The integrated services that are discussed in this booklet include mental health care services, and this, of course, would include substance use treatment, alcohol and substance use, other than tobacco. It also includes structured assessment and intervention services billed under HCPCS code G2011, G0396, and G0397, as well as primary care services. Of course, each service must be provided by an eligible professional who is acting under his or her scope of practice, and all of the services must meet any national coverage determinations, or NCDs, and local coverage determinations, LCDs, and these, of course, define medical necessity criteria. Every service billed must indicate the specific sign, symptom, or the patient complaint that requires the service that's being billed. And although a provider may consider a service or a test good medical practice, we don't pay for services without those patient symptoms, complaints, or specific documentation. We can also pay for multiple mental health services for the same patient on the same day. However, we don't pay for inappropriate or duplicate services on the same day. In our local coverage determination, that's a policy. The ID for that is LCD 34616. It's titled Psychiatry and Psychology Services. There is a link to our billing and coding article by the same name. And that billing and coding article is linked here on this slide. It is LCD Article A57480. And like the policy, the article is included in the CMS Medicare Coverage Database, or NCD. You can select the link, of course, on this slide to view the article in its entirety. And among other information, the article includes billing and coding advice that does pertain to multiple mental health services when billed on the same day. Now, in addition to the same-day billing guidelines, mental health services provided on the same day by the same provider during the same encounter are subject to bundling of payment, and this is based on edits that are within the Medicare claims processing system. And these edits are part of CMS's National Correct Coding Initiative, that's NCCI, the program that is to promote national correct coding of Medicare Part B claims. CMS owns the NCCI program and is responsible for all of the decisions regarding its contents. The edits are based on coding interventions that are defined in the American Medical Association CPT manual, policies, and also other guidelines and practices. There is a list on the bottom of this slide for which these edits are based on. There are actually 3 different types of National Correct Coding Initiative edits. They are listed here on this slide, and they are the procedure to procedure, or PTP code pair edits, the medically unlikely edits. We talked about these and refer to them as MUEs. And of course, the last one would be the add-on code edits. It is the procedure to procedure edits, though, that prevents payment for services that shouldn't be reported together. In other words, payment for one of the procedure codes bundles into payment for the other code in those code pair edits that are available out on the WPS website. There are a number of NCCI and PTP edit resources, and this slide includes links to the NCCI webpage. That's out on CMS's website. There's also a link here to a Medicare Learning Network booklet. It's titled How to Use the Medicare Correct Coding Initiative Tools. And then finally, the third bullet has a link to the actual procedure to procedure edits webpage out on CMS's website. And due to their size, if the files don't automatically open for you or unzip, you're going to need unzip software to view them. And this allows for faster download of those files. This slide serves as a reminder that NCCI doesn't include all possible combinations of coding edits or kinds of unbundling. If providers decide that claims have been coded incorrectly, they need to contact the MAC about possible payment adjustments. Providers are subject to laws. They do face potential legal actions or exclusions from Medicare programs or federal healthcare programs if they don't report and return an overpayment. Now, WPS offers a variety of overpayment related resources on our website, and additionally, we have 14 videos on our overpayments playlist on the WPS GHA YouTube channel. So what are the NCCI Column 1, Column 2 procedure to procedure code pair tables? Those edit tables are downloadable lists of code pairs, and these represent services that are rendered at the same time by the same provider for the same patient, during that same encounter. And as you can see by the bulleted items on the bottom of this slide, procedure to procedure care code pair edits show when a code is the reimbursable code of a PTP edit care. Now, although the Column 2 code is often a part of the more comprehensive Column 1 code, this relationship isn't true for many edits. Now, in some edits, the PTP code pair edit consists of two codes that you shouldn't report together unless you use the proper modifier. For example, you shouldn't report a vaginal hysterectomy code and a total abdominal hysterectomy code together. You shouldn't report many procedure codes together because they're really mutually exclusive of each other. And you shouldn't report mutually exclusive procedures at the same atomic site or during the same patient encounter. So an example of this would be a mutually exclusive situation. It would be, for example, the repair of an organ that you can perform by two different methods. You can only report one code of the two organ repair codes in a code pair. A second example would be that you can report as an initial service or a subsequent service. Except for drug administration services, a provider can't report an initial service and a follow-up service during the same patient encounter. So those are just a couple of the examples of the edits or the edit rationale. Now, it is important to note that there are different sets of PTP code pair tables out on that CMS website. One set is for practitioners, and the other set is for those providers that are reimbursed based on the hospital outpatient prospective payment system. CMS publishes these edits quarterly on their webpage. There's links here for you in bullet 2, or a link rather. The quarterly files are going to show any additions, deletions, or any modifier indicator changes. The next slide is a reminder that the procedure to procedure edit files are zipped, and this is because those files are really quite large. You can access free downloadable unzipped software on the CMS webpage where the edits are actually found. And in order to find this, where you can download free that unzipped software, you need to look for a link on the left near bottom of the page. And it reads help with file formats and plugins. And that link will then take you to a page with downloadable related links for unzipped software. The column 1 and column 2 correct coding edit tables have those procedure to procedure code pairs. And if you submit the two codes of an edit pair for payment for the same patient on the same day, the column 1 code is the one that's going to be eligible for payment. And then the column 2 code would be that code that would deny unless an appropriate modifier is used. So if both codes are clinically appropriate, then that means your documentation would justify this. Then you would be able to use an appropriate NCCI associated modifier. The codes in both columns then would be eligible for payment. So how do you know when a modifier may be used. It is in the correct coding modifier indicators column of those code pair edits that are available on CMS's website, where you will find a correct coding modifier indicator. The acronym is CCMI. The indicator would be a 0, a 1, or a 9, and this would show you or let you know if there is an NCCI PTP associated modifier that would allow payment for that column 2 service in addition to the column 1 service. So 0, I like to tell people, means that you have a 0 chance of receiving payment for both of those codes. When no modifiers are allowed, there's a 0 here in the column for the CCMI. The column 1 code is going to be paid, but the column 2 code will not be paid. A 1 CCMI means that you can use an NCCI associated modifier with this PTP code pair, but only when it's appropriate. And this, of course, is, like I mentioned earlier, going to mean that there needs to be documentation in the medical record to justify the reported NCCI associated modifier. And let me repeat, a 1 in the CCMI column doesn't mean add a modifier. It means you may add a modifier if your documentation justifies it. And then a 9 CCMI in that column means that there is no active edit for the PTP code pair. Hospital PTP code pair tables really work the same as the practitioner PTP code pair tables. However, they do differ. The information in them differs, and this is because of the differences between facility and professional services. The how-to booklet, or that MLN publication that I mentioned earlier, it's published by CMS. This actually shows the steps to follow when looking up a PTP code pair edit. And this slide follows the steps to filter the PTP data tables. And I'm hoping that in just a couple of minutes, I'll be able to demonstrate this for you if there are no technical problems getting to those files. Here is a helpful hint, and this is really taken right from that Medicare Learning Network book that I've been talking about. And this explains that the Excel list shows values in ascending alphanumeric order. So when you're scrolling through these lists, if the code you're looking for doesn't appear where it should be alphanumerically, then the code is not listed at all in the file. So just something to take note of. This is that CMS National Correct Coding Initiative Edits webpage. I've talked about this a few times. I've included the link to this page in the presentation materials that you received before this program. If you would scroll down a little bit when you're on this page, I'm going to point out just a couple of things that you want to make sure you're aware of. And the first, and Ellen, if you'd scroll down just a little bit, the first thing I want to talk about is right there at the bottom left side of your screen now. And you don't need to pull this open right now, Ellen. It is the Medicare NCCI policy manual. There's a lot of helpful information in that manual if you're looking for some guidance about the National Correct Coding Initiative edits. It's over there on the left-hand side of the page. I actually I facilitated a presentation last week for some billers and coders and such, and I talked about NCCI during that presentation. And one of the learners in my audience said, I look at that policy manual all the time. It's got a lot of helpful information in it. And there were other learners in my audience that agreed. So if you've not already given that a look, I would recommend that you do so when you get some time. The next thing I want to point out is right below it, the Medicare NCCI procedure to procedure edits. And go ahead and click on that one, Ellen, if you would please. These are those, if you scroll down, the procedure to procedure edits. And during my remarks, I mentioned to you there's two sets of tables. We have the hospital procedure to procedure edits, and we have the practitioner procedure to procedure edits. And so depending on what you're billing for, you'll need to select the correct table of edits. Most often, I find myself looking at the procedure to procedure edits because most of the education I provide are for the professional services. They aren't for those outpatient edits related to outpatient prospective payment system. Now, when you download, and I'm not going to ask you to do this, Ellen, because it will unzip and you'll need to store it somewhere. And we don't want to show anything that you have out on your personal drive for security purposes. But I'm going to tell all of you that when you choose to open one of these, or you click on one of the practitioner or hospital PTP edits, a window is going to open. If it doesn't open automatically, the Excel file itself, a window will open and you'll need to unzip or use that unzip software I told you about in order to access the file. And when the file comes up, when you use that unzip software, you're going to find that it's an Excel spreadsheet. And Ellen, next, if you would, go to the CMS search box. And what we're going to show is that wonderful book called How to Use the NCCI Edits. I think if you just say how to use the NCCI and hits the search, the magnifying glass, we'll be able to get there. All right, let's scroll. Right there is that great MLN educational tool that I talked about. You have the link to this. And as you scroll down, you will see that this provides those step-by-step instructions to be able to look up those code pair edits to see if there is a payment indicator or a modifier indicator rather that allows you to select or report on your claim an NCCI associated modifier in order to unbundle payment of the column 2 code. So this includes the information about how to. So I call this the how-to booklet. Ellen, if you'll scroll down just a little bit more. I want to show you that within this book, there's some illustrations that show what the unzipped code pair tables look like. So if you'll keep moving along, right there's a good place to stop. Thanks, Ellen. This provides for you information, or actually provides those code pair edits. So if you are a provider who on a claim reports, for example, a G0101 and a 99215, you need to check the procedure to procedure code pair edits to see if there's an edit that exists. Normally, it is the column 1 code, or it is the column 1 code, and I shouldn't have said normally. It is the column 1 code, or that column A code, that is going to be the payable service, and the column B code is going to be that code or that service for which Medicare would deny payment, because payment would be bundled into the column A service. So if there is an effective procedure to procedure code edit, and you can see the dates that for the effective date in column D. If there's a deletion date, you'll see a deletion date in column E. If there's an asterisk, you'll see no data. If there is a code pair that is in effect, a code pair edit that's in effect, you need to look at column F. And that is that correct coding modifier indicator that I talked about during my prepared remarks. If there's a 0 in this column, that means there is a 0 chance that you will receive payment for both of those services. And one example of that would be the second line here on the procedure to procedure code pair edit file. So that means that Medicare never allows payment of G0102 when you're billing a 99215. The 1 means if a 1 appears in column 5, would mean check your medical documentation to see if the documentation justifies appending an NCCI related modifier or associated modifier to your column 2 code so that Medicare can allow payment for both services. And then, of course, a 9 in column F means that the service is not valid. If you look at column G, this provides for you the edit rationale, the reason why CMS will not allow payment for both of those services unless you're using an NCCI associated modifier and your documentation justifies such. Remember that these files are updated quarterly, so you need to make certain you're choosing the right code when you go out and unzip them. Now, the next thing I wanted to show you or bring your attention to, and Ellen, if you'd just scroll down a little bit more, is the ability for you to filter your services. And this is the instructions here. Ellen's moving down through this. This right here tells you how to filter these data tables so that, remember I told you these codes are alphanumeric, so that you don't have to look on line 15 that includes your code, and then your code doesn't appear again in column 2 until line 115 or line 175. What you can do is view all of those instances where the code you're searching for appears at one time, and this tells you how to do it. You'll move down a little bit, Ellen. I can talk through this, although we won't be able to demonstrate live because we don't have the Excel file actually pulled up and unzipped. So when you want to filter for a specific code, what you would do is you would open your file would be open. You need to make certain that you're all the way to the top of the file, and you would choose data, and you can see that's underlined in green here is to show you or point out. You click on data, and then you click on the filter icon in the ribbon. And when you do that, a little drop-down arrow appears at the top of the column. So for column B, there's a little drop-down arrow that shows, and Ellen's showing you the drop-down arrows in the other columns. If you choose that drop-down arrow and you're searching for example, code 99215, when you click on the drop-down arrow, it's going to open up a filter, and then you would enter your code 99215, and then it will pull together all of those instances where that particular code appears. So you don't have to look at line 15 on the Excel spreadsheet and then scroll and scroll and scroll till you find it again, way down on line 115. What it does is it pulls them all together. Let's scroll down a little bit to see if there's an example that shows once you use that header. This is where I told you you would enter the number when you click on the drop-down arrow at the top of the column you're filtering, and then you would key in your code or select your code if it appears. Down a little bit more. This one, they're filtering in 99215. And here then are the results. You can see you filtered column 2 for 99215, and then it will bring all of the column 1 codes together, for which the 99215 is that column 2 code. Okay, so it's just a great way to pull all of the data together so you don't have to scroll and scroll and scroll because these files are so very large. All right. That is the end of my prepared remarks. If you have questions that relate to the information that I provided today, I'd be happy to take them. Just as a reminder to send us a question or pose a question about bundling of Part B mental health services, you would type that into the chat feature and Bailey will let me know. And actually I can see the chat feature now. If you'd like to send a question, now's your opportunity to do this. Thank you, Nicole. Nicole remarked, thank you for going through this resource. It was very helpful. I'm really glad you found it helpful. And as we are awaiting additional questions to come in, I am continuing to look at questions and I see none coming in. So I am going to move on and talk now about our survey. This is an opportunity for you to provide feedback to WPS. Your feedback is important. It allows us to make timely updates to our website and other education resources. Thank you for attending this event on behalf of Bailey and Ellen and me and the whole provider outreach and education team at WPS GHA. We wish you a very wonderful rest of your day. Thank you so much. You can disconnect.